Welcome to this chapter on what can go wrong and common methods of treatment. In this chapter, we'll give you an overview of what sort of problems can affect muscles and what methods of treatment are available. The following conditions are common that can affect the muscle systems. Injuries, including strains and tears, muscle disorders, muscle spasm, and myasthenia gravis, an autoimmune disorder that is marked by severe muscle weakness. Injuries that occur to muscles, tendons and ligaments are normally in the form of strains and tears. Injuries to muscles and their tendon attachments are usually the result of exertion during daily activities or sudden pulling or twisting movements, such as those occurring during sporting activities, such as a torn Achilles tendon. Various actions at work can also damage muscles and tendons, and a tear is worse than a strain. Repetitive strain injury, or RSI, describes a range of conditions caused by constant repetition of particular movements. Certain constant use of wrists and hand movements, such as using keyboards, can contribute to this problem. Symptoms normally range from mild to sometimes severe pain, tenderness, swelling and bruising. Unless there is a reason to result in surgery, such as in the case of torn tendons and ligaments, the treatment is usually to immobilise the area affected and give anti-inflammatory drugs, such as ibuprofen. Some extreme cases may need considerable time to repair, and sometimes cortisone is used as a drug type. After that, it's very much down to Mother Nature to take her normal sequence of events and time to repair the damage. Physiotherapy can play a large part in the recovery of damage from strains and tears, and again, a long time of rest may well be needed. Torn tendons and ligaments, rather than sprains, require immediate surgery, otherwise the broken ends tend to never repair properly. The most common form of muscle disorder is muscular dystrophy. Muscular dystrophy is a term that describes a group of inherited disorders which leads to progressive degeneration of the skeletal muscles. There is no medical treatment to date. The best that can be done is by easing the symptoms when they occur by the use of physiotherapy and supporting devices such as wheelchairs. Unfortunately, there are also additional complications such as cataract formation in the eye and problems with the heart and breathing as well. And it can also lead to problems with reproductive systems. Depending on the type and severity of the condition, it can be rare, unfortunately, for some patients with muscular dystrophy to survive beyond the age of 30 or 35. Muscle spasm is the involuntary and often painful contraction of a muscle or group of muscles that stiffen an arm or leg or make it difficult to straighten the back. This can be caused by injury, can sometimes come on without warning, or can be related to osteoarthritis. Another form of muscle tightening is spasticity. This can be seen in a number of neurological disorders such as multiple sclerosis and cerebral palsy. These conditions are helped with physiotherapy, with medicines to ease the symptoms, but there is no cure. In many cases, muscle relaxant drugs are used to ease the condition. Centrally acting drugs, such as baclofen, reduce the strength of nerve signals from the brain, resulting in the muscle relaxing. More locally acting relaxants, such as botulinum, can be used to reduce spasms that are accessible to the body from the outside, such as around the eyes and the neck. Myasthenia gravis is a disorder of the immune system that is marked by severe muscle weakness and fatigue. It is caused by antibodies that gradually reduce the number of receptors that stimulate muscle contraction. The main area of the disorder is focused on the muscles of the face and the throat. There may be double vision and drooping of the eyelids. Later, as throat muscles are involved, there may be difficulty in chewing and swallowing. The condition is treatable. In some cases, the removal of the thymus gland appears to help, and also the muscle weakness can be treated with injections of medicines such as phytostigmine, which removes the sensitivity of muscles to respond to nervous stimulation. Generally, it is a wasting disorder, but can be kept under control and give the patient a good life expectancy.